So the simple answer is get the one that's most available to you now. All three of the vaccines, so Pfizer, Astra Zeneca and Moderna, have been proven to be safe and effective. So they're all really much of a muchness. But if you have any questions, go and see your doctor or your pharmacist and have a chat with them about it. Possibly, so we don't really know yet. Overseas it's starting to show that some people are having to get a booster shot after 6 months, but nothing's been announced in Australia yet, but it is a possibility. Getting it now is to get protected now. So it's so widespread at the moment, we really need to protect our community right now. And in the future, it might be just like the flu shot, where you need to get a booster every year to get protection depending on the variant that's around. As a general rule, whatever you've had as your first vaccine is what you get as your second vaccine. Sometimes there can be exceptions to this if you've had a severe allergic reaction to the first one, but generally if you've had Astra as your first one, you'll be getting Astra as your second one. At the moment, the Moderna vaccine's just hit Australia and it's going to be rolled out through pharmacies to start off with. But we don't know whether we will be getting it at Wathaurong at this point, so watch this space. But you can get Astra Zeneca and you can get Pfizer through Wathaurong, and they're just as effective and just as good, so book your appointment now. Yes, you can still get COVID after getting the vaccine, but the version you get is not quite as powerful as the full version if you weren't vaccinated. So what that means is you might not have as much virus in your body. And that's really important too, because that reduces you from getting really sick from it, but it also stops you from spreading it to other people. So the common side effects for COVID-19 vaccine are muscle aches and pains, maybe some soreness in your arm, some itchiness, so a reaction on your arm. You could feel a bit headachy, quite tired and fatigued. They're the more common side effects. The person administering your vaccine will go through with you all the possible side effects from the vaccination and what to do in a situation where you might get something that might not be quite so common. At the moment, there's no vaccines approved in Australia for children under 12. So the best way to protect children under 12 is to get vaccinated yourself. You could get really sick, so we don't know who's going to get sick from COVID, and a lot of people are saying, oh, it's only people that have got chronic conditions, but there are a lot of people out there with chronic conditions, and even some healthy people are still getting quite sick with COVID. And they're getting so sick from heart and lung issues that they're ending up in hospital and even in intensive care on a ventilator to help them breathe. Okay, you may have heard this term long COVID being thrown around a bit. So long COVID are the long-term effects from getting COVID. So we all know that you can get an acute illness and that some people get quite sick from it and end up in intensive care. But long COVID is we're finding that people are still having effects 12 months on now. They're still feeling quite fatigued. They're having effects on their heart and lungs. So it's really important to get protected against this. This isn't true at all. I'm a pharmacist and I've never received a letter. But when we become registered as pharmacists and doctors, we take an oath to first do no harm to patients. So our number one priority is your health and keeping you safe. And whether that's the vaccine or not, that's a discussion we will have with you. There's been a lot of misinformation surrounding COVID-19 vaccines and their impact on fertility. I want to reassure you that COVID-19 vaccinations do not affect fertility and are safe for people planning a pregnancy and people that are already pregnant. For medications or vaccines or anything in Australia, they have to go through a rigorous process through the Therapeutic Goods Administration before they get approved for use. So they do lots of testing. Some people think that the vaccine came quite quickly, but it was tested in a lot of people before it was released in Australia, and the technology had been used overseas for some time. So the vaccines get tested for what the ingredients are, so we know what's actually in them before they get put into people's bodies. So there's been lots of research done on what the ingredients are, and we can be guaranteed they're safe. Just like when you take Panadol, you don't know absolutely every little ingredient that they've put in the tablet as a filler. It's the same with the vaccine. They put other things in there to keep the dose stable and things like that, so that we can get it from the factory to you in a good condition. So at Wathaurong, all of our staff, our doctors, our Aboriginal health workers, our nurses, our pharmacists, we've all got your health and safety at the forefront of our mind. So we want to look after you and make sure that you're safe and healthy. So we're happy to have a conversation with you about any concerns you might have, and make sure we find the right vaccine that you feel comfortable in having to keep you healthy and happy and being able to spend time with your family and your loved ones.